Hi, everybody. I don't have to introduce myself to too many people. I think almost everybody knows me. But for those of you who it's your first time, welcome. I'm Dr. Tracy Kroll. I'm the behaviorist here at Red Bank Veterinary Hospital. And tonight we're going to be talking about separation anxiety. Now you're going to notice that in a lot of the slides, they apply to all forms of anxiety. These slides are from a presentation I gave to a group of veterinary technicians, how to address anxiety in general. And as I started to put the presentation together for this, I realized that it doesn't really matter what the word is in front of anxiety. Although the specifics change a little bit depending on what the problem is, the method to treat it are the same. So we're going to use how to treat anxiety, and then we're going to gear it towards what we're talking about tonight. Let me make my common disclaimer. I will stay all night long and answer your questions after the presentation. But please wait until after the presentation if your question starts with, I have a, and this is what I'd like you to tell me about my dog. I'll stay all night long and talk to each one of you if you want me to. But as a group, let's focus on the general, and then we'll deal with your specifics. That's what I'm here for, and I'm happy to help. If you have a question and I'm rambling in the middle of something, wave your arms, scream, yell, throw paper airplanes at me, get my attention, I will stop. I will warn you, I in general try not to use too many PowerPoint presentations because I have a little bit of OCD and I go off track really easily, or ADHD I guess, and I ramble. So don't try and follow the slides and think that's going to give you a concise view of where I am, because it may not be. We may go off in another direction, but I promise you it will be informative. If something doesn't make sense, or if I say something that seems counterintuitive to what you're thinking, that's another good reason to wave your hand and say, but I heard, and we will either agree or dispel, and I think that's good, because dialogue is part of education, and I like to learn from you guys too. Very quickly, let me tell you a little bit about my background in dealing with behavior problems. I am a veterinarian, so first and foremost, that's who I am, that's how I describe myself. Except if you ask my 9-year-old, he describes me as mommy. I have a unique perspective on nonverbal species. My 7-year-old is a nonverbal autistic child. So I deal with trying to read body language in nonverbal species every day. My daughter Hannah communicates better than any child I've ever seen. She just can't talk. And so I say to people that, God gave the child and the mother the right pair. She has the right mother, I have the right child. And as I start working with Hannah, I realize, wait a minute, this is what I do for a living. These dogs are trying to talk to us. They're trying to communicate with us. And so hopefully tonight what I'm going to show you is that there are ways that we can hear what they're trying to tell us, and there are things we can do to try and help them without them having to say a word. Although some of them, you wait. I think when we leave the house, they get on the phone with one another. You should have heard what my mom did. It's no wonder that we see a lot of pets for separation anxiety. In particular, we're going to focus on dogs tonight, but we certainly do see cats with separation anxiety. Dogs uniquely have separation anxiety, and I am really honestly surprised more dogs don't have separation anxiety. Dogs as a social structure live in family pack units. Every day their entire pack leaves without them and closes the door and leaves them behind. How do we think they should feel? They're pack animals, they want to be with their pack, and we leave. So it's surprising that some of these dogs are so darn adaptable. I mean, they really do us a service versus a disservice. But some of them can adapt, and those are the ones we're going to talk about tonight. So of course, because I said that, we're going to start with a picture of my cat. My cat clearly does not have anxiety issues. That's her general kind of, that's actually how she stalks my dog. My dog is 17. And so now she realizes he can't see or hear her. So it used to be she used to do that like pouncy stalk. Now she just lies on her back and waits for him to go by. It's no fun anymore. So hopefully we're going to teach you in your own pets to recognize some of the signs of anxiety versus the one that's just holding up the big neon sign that says, hi, I'm anxious. And hopefully we're going to find some ways to treat these guys to increase the quality of their lives, because that's really what treating behavior problems is all about. It's making them feel better, and then that's a win-win because then we feel better. and then our houses aren't destroyed, which usually makes our spouses feel better. Okay. So I think probably an appropriate place to start is, what is anxiety? You know, we banty that term about. We say, my dog is anxious. Do we know what we're saying? Anxiety is really, think of it this way. I anticipate something bad is going to happen, and my reaction to that, this sense of doom and dread, that's anxiety. It's the feeling that something bad is going to happen, usually to a stimulus that shouldn't be provoking that reaction. It can be rational, it can be irrational, it can be perceived, or it can be real. So your owner leaving the house is a real stimuli, and you can react to that with a feeling of foreboding. The anxiety is, maybe she won't come back. Maybe I'm here alone. Maybe she's going to desert me like the last people who put me in the shelter. Is that rational? No, you come home from work at 5 o'clock every day. But that's the feeling the dog has. And that's what anxiety is. Remember, anxiety is stressful to the pet. It becomes even more stressful to you. But it starts with remembering when we're treating these problems that what we have to treat first is the fact that our pets are distressed. And I think that's really important. Most of them, the symptoms they're showing are not because they're trying to be bad. It's not because they're trying to misbehave. It's because they're trying to tell us they're nervous, they're fearful, or they're stressed. If your child said, I'm afraid of something, would you say, go in your crate, sit down? No, you'd approach it appropriately. And hopefully we'll do that with our pets. Okay, that's my daughter. Always have to put pictures of your child. That was my daughter last week. She had to go to the dentist and have some fillings done. So of course, being that she's a special needs child and would bite the finger of the dentist off, and that is not because she's a special needs child. That's because Hannah would bite the finger of the dentist off, whether she was or not. We had to go to the hospital, and she had to go under anesthesia to have a couple fillings. That's that anxiety. That would be me. So I knew what was going to happen, and it gave me a feeling of foreboding because my baby had to go under anesthesia. I was experiencing anxiety, even though I knew the outcome would probably be favorable. For our pets, they have a number of things, stimuli, that might cause anxiety. Unfortunately, my little unsmiley face is coming to see me. I like them far more than they like me. They anticipate that I'm going to have a thermometer, folks. I'd be anxious, too. But any of these things, and there's probably more you can identify, can produce that feeling. The one we're going to focus on tonight is separation. And of course, if I show a picture of my daughter and my son walks in while I'm doing this, I have to then put a picture of him up because he's 9, and then he says, but I'm cute too. Yes, you are, dear. Okay, so let's think about anxiety. If you have a feeling of foreboding or nervousness about one stimuli, the chances are other things are going to start to make you feel that way. It's additive. So think about it. I'm going to pick on you. He's nervous about something I'm going to do in the room, and he starts to give off that nervous feeling, and he's getting tense. The person next to him is like, why is he so tense? Oh, maybe something's going to happen. And then the people behind them say, oh, look at them, they're really nervous. After a while, I can get the whole room worrying about what I'm going to do, which, I mean, I'm sure Karen is back there worrying about what I'm going to do anyway. That's what happens with anxiety. If you have a dog who's nervous about you leaving, and then the marching band comes down the street, and then the thunderclaps happen, and then construction work is going on, imagine every time the next stimuli hits how hard it is to try and cope. That's why anxieties tend to get worse, because more things tend to bother you. They cycle on themselves. The good news is they can also cycle the other way if we can get things under control, which we're going to talk about. One of the things about anxious dogs is that their coping skills are usually very low, especially by the time we go to a place where we're going to try and treat the anxiety. Usually most of them, their reserves are gone, folks. These dogs have tried the best they could to adapt based on environmental situation, based on where they came from before you adopted them if they're a rescue. A lot of them are just tapped out. And so that's why we have to intervene, and we have to be the voice of reason here, because they just can't. So it's really important to try and get as much information in your head together about why your pet's doing what it's doing, and that's why the picture is up. You have to become a pet detective. No, you do not have to become Jim Carrey, but you do have to be a pet detective. You have to figure out the who's, the whys, the whens, the whys. If you can come in and tell me my dog is anxious in situation A, B, and C, and I know this is the reaction he has, and these are what he does to show me he's anxious, we are going to be able to more successfully put together a plan to help him than if you just say, my dog is nervous, right? Makes sense. The more information we have, the better. So, what am I looking for to say a dog is anxious? When I see a dog in the veterinary hospital setting, I expect most dogs are going to be anxious, right? I mean, you come to the veterinary hospital, you hear other dogs barking, you smell sick dogs, and you're there, and I come whisking in, hopefully not at the time wearing my stethoscope and my white coat with guns and vaccines ablazing. Most of these dogs are exhibiting one of these things unless they happen to be a happy-go-lucky dog, and then you just kind of look at them and you wonder why they don't have a behavior problem under that stimuli. If they're doing these things at home, that's inappropriate. There's no reason in your safest place in the world you should be pacing and panting. Has anyone ever, raise your hand, have you seen nervous yawning? Or the dog that goes, nervous licking? Those are all signs of anxiety. That is, the dog finally can't hold it in anymore. I mean, dogs are pretty stoic, right? You know, they don't tell you something's wrong until they have to. If they're exhibiting these signs, they're to the point where they have to. They can't hold it in anymore. It's like, it's bursting out. The sweaty paws, yep. Drooling, I don't even know, did I put drooling up there? But drooling can sometimes go, the bottom one. I get a lot of dogs who are brought into me where the chief complaint is the dog has become aggressive, where what's really the problem is the dog is anxious. And so when you think about fear and anxiety, how are you going to respond to that? Some dogs become defensive based either on breed or experience. So it's important to look at all of these things, and if I see other things along with that, puts together a very different picture for me. Okay. So when we look at separation anxiety, in particular, we're going to look at these 5 groups loosely for treatment. I have to treat the environment. If anxiety is being caused by something in the environment, that means something has to change or else the anxiety is not going away. Now, there are some things, as we're going to look at, that can be changed and some things that can't. Unless every one of us wins Powerball tomorrow, we can't stop going to work, right? So there are some environmental changes that have to be, if you have a baby, the chances are you're not rehoming your baby, whether the dog likes it or not. But there are things you can do to alter the environment to make it feel better, and we're going to talk about those. Next is we have to treat the behavior of the pet. We have to treat the symptoms of anxiety and lower them. Next, I have to treat your behavior. What are you doing that's either helping, hurting, or is neutral to the problem? More often than not, when I see a dog where the owner is part of the issue, it's because they're doing something they think is helping, but the dog is reading it differently. It's just a miscommunication. Most people, when they come to see me, I mean, certainly most of my clients, it's not malicious intent. It's, I'm trying this to try and make it better, but it's making the problem worse, and I don't understand why. So so education becomes really important. You'll notice way down my list, after all of that, I put pharmaceuticals. For some dogs appropriate, for some dogs not. That is not an absolute that I put up there as a treatment group. There should really be a question mark after that, right? For some dogs, it's appropriate. For some dogs, it's not. And we're going to talk about what my criteria for thinking it's appropriate are. And then the last one will probably fit into all of those categories. I put it separately so that I could use pictures, so I could show you what they were. But supportive equipment and then alternative modalities to treating anxiety, and we're going to talk about a few of those. They would fall in that group. Okay. This is a picture my son took with my cell phone as we were driving down the Garden State Parkway, and he saw this house at Christmas time, and those were all Christmas lights. And he was just absolutely fascinated by this house and made me like turn around on the parkway and go the other way so he could see it again. Mind you, we're Jewish, so we don't have Christmas lights. So this was really a big phenomenon to him. So I'm looking at it, and he's like, wow, that's so cool. Can you imagine going out and playing in the lights? And of course, my thought was, oh my God, I hope they don't own a dog. Where is he going to the bathroom? Can you imagine, like one day you go out in your yard and you're sniffing around, you pee, and then the next day you come out and that's what you find? Holy moly, you're peeing in a Fisher-Price toy. Wow. So environmental stress, you know, What we define as environmental stress and what our pets define as environmental stress may be vastly different. Sometimes environment can be altered. If you have a dog who is now suddenly afraid to go outside and that's what your yard looks like, I can alter your environment. You've already altered your environment. That probably fits in the next group, but if you put that many lights up, we probably are into client behavior, but that's another whole story. But there's some things that can't be altered about an environment. You only have so much square footage in your house. You have a schedule that can't be changed, and the human family members that are a member of your family are probably a member of your family. Those are things, if they are causing anxiety in the dog, I can't change. And we have to decide if it's a deal breaker for the pet or not. Right? All of this is, every decision has to be based on the quality of life of the pet. There are some times where an alternate environment may be the best option. I didn't say the only option, I said the best option. If you have a small house and you've added the 17th dog to the house, maybe there's one too many dogs in the house. If you have a dog who has never been exposed to children and now suddenly you have triplets, I can't change the new dynamic in the house. You have triplets. But if the dog is reacting such that he has no quality of life, maybe something has to happen about the house that we create two spaces within the house, one that's child-friendly and one that's dog-friendly. That statement doesn't always mean rehoming the dog. That's not what I mean by that. What I mean is perhaps an alternate environment within the house has to be created. But we have to look at all of those options openly. And again, if you always are making the decision, is this right for the pet, you'll never go wrong. You know, I try not to make decisions based on what's easiest. I try and do what's best. And sometimes what's best is the hardest. But we talk about them. Okay, so stressors in the home. I'm sure you can probably think of 300 more stressors in the home. These are the ones that came to mind right away for me. The space-to-pet ratio is actually probably more important with cats than it is with dogs, but I put it up there because there is only, especially with dogs, it's not like we can with cats, we can go upward. With dogs, I can't just put another cat tree or dog tree in the house and hope I'm adding more space. I only have a limited amount of room I can keep dogs in, especially if they're injuring themselves in separation anxiety. If dog breaks out of crates and is hurting himself and throwing himself out windows, then I can only change the environment so much to make this dog safe. So the environment is not the group that I need to be concerned in that dog. If, however, the space needs to be altered such that a dog has a more quiet area to go when he's nervous, that I can probably create in most homes. Right? New additions. New additions can be, the easiest one to identify is child coming, but it can be Mom and I lived in New York City in an apartment for the first 8 years of my life, and now she gets married and moves out to the suburbs with Dad and his 3 dogs. New members of the family. Creates a whole new dynamic. Mom is excited about the move. She wants to think everybody's excited about the move, but maybe Fluffy is not excited about the move. So that's something to think about. Removal of access. Sometimes if you have to change things around, like the room that the dog likes to sleep in the most now is the new child's room. You've removed access to a safe spot. You have to think about that. We can't just start moving things around. You know, you move the crate to another room. The dog has to sleep in a different place. Now you're married and the husband doesn't, or the wife doesn't want the dog on the bed. Those are all changes that the dog is going to be reacting to. The weather. I have yet to be able to control the weather. Can't. If you live in the South, thunderstorm season is 10 months a year. So if you have a dog that his anxiety is over thunderstorms, you have a big problem on your hands. It's the #1 thing they see at the University of Georgia for behavior problems. They see thunderstorm phobia. This is where your reminder to me comes in handy. #1 time I see separation anxiety, bar none, and I want somebody to figure out why once I tell you, is the week after Labor Day. Why? No. Everybody goes back to school. Everyone was home all summer long. Everyone was with the dog, playing outside the yard, going in the pool. A lot of teachers adopt dogs during the summer because they think I have all summer long to train my dog. And then the week after Labor Day, they leave abruptly. And the dog is like, hello? Me? Hello? Anyone home? Wow, it's really quiet here. 2 kids went off to college, mom went back to school, little kid's not screaming anymore, I'm alone. Pack, help, pee. Separation anxiety tends to be seasonal. We see a lot of it after the holidays. After the excitement of the holidays has died down, we see a lot of it after Labor Day when a lot of the excitement of the summer has died down. Those are the 2 big times when people acquire pets. Number 1 type of dog I see for separation anxiety, bar none, has nothing to do with sex and it has nothing to do with breed. Shelter dogs. Any breed. You know why? Because they were deserted at a shelter for whatever reason, and then they get adopted, and you spend 2 weeks at home bonding to them, and they've bonded to you, and they say, thank you for rescuing me out of that cage. Don't leave. I love you. It's a backhanded compliment. They don't want you to go anywhere. But then we leave because we have to go back to work. But it's hard to explain that if they want the kibble and the snoogies and the wardrobe full of clothing, that you've got to work for that. $40 million a year we spend on dog clothes. Oh, there was my ADHD moment. Yeah, sorry. We don't spend that much on vaccinating our pets in this country. We spend it on raincoats. I guess if weather's a concern. Yeah. And then the last thing that tends to cause a lot of anxiety for pets is strangers coming to our house. They're not strangers to us most of the time, but boy, they're strangers to them. And sometimes we forget that, we're way up here greeting the plumber, and our dog is down here going, holy moly, new person coming in the house. So stranger danger. Okay. So these are the things we're talking about. I can't control these things. If these are part of the problem, then we have to acknowledge that this group of treatment is not going to be where we're going to find our success, and we have to know that it's going to probably in some way limit our success. So we have to accept it, understand it, and then find other ways to deal with it, but know it's going to be a hindrance. That's all. Woohoo! Here we go, backwards. Okay. So modifications I can make. This is my house. The reason I put this picture up is, most people when they buy a home, my real estate agent says to me, oh, because I was pregnant with my second at the time, you probably want a nice big kitchen and a yard. I was like, I want an airlock. She looked at me, a what? I want a front door with then a door behind it because I have a home office, and when UPS comes, I want to be able to shut myself in there without the dogs, open my front door and get my package and close the door without the dogs trying to kill the UPS man. So she was like, but don't you want a nice sunny kitchen? I'm like, I want an airlock. And my husband was like, trust her, she wants an airlock. I'm like, a nice kitchen would be nice. And that's really why I picked this house, because it had what I used to do in my old house is put my poor little guy, and you'll meet Spike in here. Everyone's met Spike if they come to enough of my lectures because he has so many behavior problems. I used to put him in my coat closet when UPS would come because he was an ankle biter. He's a little terrier. And there were times when I'd be so, I had a baby and I'm running a business, and all of a sudden in about 10 minutes I'd hear, because I'd forget him and leave him in the coat closet. So this poor dog, so I couldn't put my shoes in the coat closet, and I put my dog in the coat closet, and then I'd leave my dog, and then I'd feel guilty because I'm Jewish, so I have to feel guilty. And then my son is like, I think Spike's in the closet, Mommy, really loudly. I was like, oh, boy. So airlock. And this is how I manage it. My little guy was nearly kicked to death by his first owner. So working people with boots, plumbers, electricians, delivery people, they scare him. He doesn't need to be exposed to that, so I found a way to environmentally manage it. Is Spike still like that 16 and a half years later? You bet. He's blind and he's deaf and doesn't move around a lot anymore, so it doesn't matter. But I never really fixed the problem. I managed the problem. And so my point is, environmentally, you can manage a lot of anxieties. He was anxious about people coming to the door. I limited his access to the door. I didn't make him have to go through the anxiety of the door opening and seeing somebody he didn't want to see there. He couldn't go there. The other thing I do under this is you'll see there's a little rug there. I have a corresponding rug on the other side. All of my other dogs, when the doorbell rings, they have to run to their rug. I don't let my dogs bull rush the door. I mean, I don't like being, when I go to, because I do house calls up north, the last thing I want when someone opens the front door is big dog to come flying at me, even if he's friendly. I'm like, they tend to get the claws, and I always get the one who likes to rake me down the front. I'm like, it's so nice to meet you. I like my dogs to stand back and greet people when they want to be greeted. It gives the person the choice whether or not they're a dog person or not. Because I am doesn't mean everybody who comes to my house is, and I try and respect that. So that's another environmental management. If you have a really smart guy, you have a border collie, you could probably teach him to go sit on the sofa, and have a drink ready for them. Martini? Not my Spike. I'll tell you a quick story about Spike. I was telling this today at work, and I had them hysterical. I had 2 terriers when they were younger. When I was doing my residency, my vet school dog, who was therapy certified and was very bright, he was a Cairn Terrier, and I noticed every morning at about 6:30 he'd get up with me and he'd go sit near our sliding glass door, and I thought it was because we had wild turkeys out in the backyard and he'd like to watch them. And he'd angle himself parallel to the door, and the reason is when the alarm would go off at 7 and my husband would get up, Spike would hear the alarm, screech, and go running thinking it was the turkeys, and go running and hit the glass door head on every morning because he always forgot there was glass there. So my other dog was sitting waiting to watch Spike bounce off the door. And so I thought, oh, he couldn't be doing that. And as soon as Spike would do it, Devin would go and leave. He was getting up in anticipation of watching my anxious dog hit the glass. Some dogs are smart, some dogs are cute. I tell people about Spike. Spike his whole life, he's a dork, but he's my dork. I love him. I don't count on brains from him. And this is now his arch nemesis, my cat. She's 3, he's 17, and she's figured out that the bell doesn't work anymore because he can't hear her. So options for spacing cats, we can't do this with dogs with separation anxiety, but is to give them, so with my cat, I created vertical space. Because I keep telling her, the circle of life is going to happen, and Elton John is going to hit, and the song is going to come on when Spike passes away, and I'm going to bring a puppy in the house, and you better have a place to go because that dog's going to be able to keep up with you. And you know what? My kids don't bother her. That's the other rule. When cat is on her tree, when dog is in his bed, kids don't touch. That's their safe space. I've created safe spaces for them that is child-free, and that's an absolute rule in my house. I think dogs deserve that. It also gives him a space when he's tense. I watch him. Now it's a little bit more teetily. I can hear on the hardwood floors now, I hear as he's walking. If he gets nervous, he goes right to his little cup and lies down because that's his safe place. Again, Spike, more than anything, has been environmentally managed. When people come to the house, he gets the one treat he likes more than anything in this world, a greenie, and he goes to his crate. And he's happy to go to his crate because it's the only time he gets one. He doesn't have to deal with the people who make him anxious. He's content, and no one's going to get bit. And to me, that was a win all the way around. And notice I haven't said a word about pharmaceuticals with that dog yet. Now, coincidentally, he was on pharmaceuticals. But that came in the beginning for the first 6 months when I had him because he would scream every time my husband would come home from work. But that's another. Meatloaf took care of that. There's Spike. So there's Spike in his safe place. You'll notice we moved it so that he's jammed in the kitchen right near the heater. We also have a gate so that he can't hurt himself going up the stairs because he fell down the stairs a couple times, so I put a gate up. That also is to keep Hannah from marauding up the stairs. But his little safe place is where he goes when he's tense, and he was taught to do that. Giving a dog who has separation anxiety a place to go where he feels secure, and it doesn't have to be a crate, it can be any place the dog feels secure. I had a woman who complained to me. She said, every time my dog is anxious, he goes in my closet. I can't stand it. He goes in the closet. I said, okay, let him go in the closet. But it's so unsocial. He's anxious. He doesn't want to be social. He wants to feel safe. She said, but my shoes are there. I said, get it under the bed shoe rack. It'd be cheaper than the dog eating your leather shoes. Manage it. I know. Reality hits. So these are all things with separation anxiety that I consider as resources that we can alter. If your dog tends to activate his adrenal cortex when he's nervous, i.e. he pees when you're not home, make sure you know when he has water and how much he's drinking. Maybe that dog needs a bowl of ice cubes that will slowly melt during the day so he has water, but he can't guzzle the big bowl as soon as you leave and then pee it out all over your floor. Time when your dog goes out so that he's defecating on a fairly routine schedule so that he's not pooping all over or in his crate. No one likes coming home at 5 o'clock and finding their dog covered where they have to give him a bath, and all of us, I'm sure, have had that happen once or twice in our lives, where you come home and the first thing you have to do is clean up the disaster wherever it is. Not fun, but it's not fun for the dog either. And he didn't do it to be Please, let's eliminate this word. I know no one in this room would use it. The dog is not being spiteful. The dog is being anxious. How many of you, if you're nervous and go on a long car ride, what's the first thing you do when you get there? You pee. Right? I mean, nervous people, when they get out of the car, the first thing they do is run for the bathroom. Why are we so surprised that our dogs do the same thing when they're anxious? And then we're not home for 8 hours. What are they supposed to do? They pee. That's why they do it. Okay, so I know. My little 17-year-old sad sack of Spike. Poor Spike has been through a lot in his life. I use Spike in every way. He'd be so embarrassed. I use him in every one of these lectures because he has every behavior problem I talk about. He's marginally housebroken. He has stranger danger. The only reason he doesn't have separation anxiety is because my mother's retired and lives with us, so there's always somebody home. He doesn't like other dogs. He attacked an Akita in my yard. Remember, he runs into glass doors. This was also in, I think, so this Akita with his owner, who kind of looks like Shaggy from Scooby-Doo, comes wandering into my yard, and Spike leaps in the air on top of this Akita and is like ripping hair out of the Akita. My Cairn Terrier goes over, and the two of them are like sniffing each other, and like my Cairn Terrier is like, yeah, sorry about him. Well, and so then, of course, what does the guy say to me? He goes, dude, my dog's not aggressive, don't worry about it. Do you see the mouse on top of your dog trying to attack him? Yeah, poor Spike. But yet, Spike is 17. He made it. He made it, folks. I got him at 1.5 years. The animal control officer who brought him in said, I think he has pneumonia. Can you take an x-ray? And I took an x-ray, and I almost called a university because I couldn't figure out what the lesions on his lungs were. They were like horseshoe. I'm like, maybe it's lungworm. The animal control officer came back to the hospital and said, oh, no. See that? That's a steel-toed boot. That's how I got Spike. And I said, tell him he died. Tell him he jumped out of the van. Tell him he, filed for emancipation. Tell me. He said, oh, yeah, he doesn't want him back. I said, well, good, because now he's mine. And that's how Spike came to live with us. And I don't think Devin my other dog, ever forgave me for bringing him home. Because like, you brought what home? Whew. Yeah. Everyone always thinks the behavior, they always say to me, you must have such well-behaved pets. Kidding? We take the ones no one wants. You talk to the cardiologist here and find out how many of his pets have a heart murmur. We get what we treat. I couldn't have picked like, I don't know, like ophthalmology. I mean, I'm sure they all have like one-eyed dogs. That would have been a lot easier than picking behavior. But no, yeah. Poor Spike. I'm going to miss it. I'm going to talk about Spike 30 years from now. I'm going to be like, I had this dog named Spike. From the grave, he's going to haunt me. So things we want to talk about with anxiety. Once we identify, and in this case, if it's separation, once we identify what's causing the feeling of unease, that's when we can start to address how we deal with it. Until you address that, the dog's not going to get better. So the trick is to find a way to get whatever is happening not to cause the feeling, right? Because the anxiety is the feeling of she's never coming back. Now, most people say to me, but doc, I come home every night. So you would think after a while the dog would figure out I come home at 5, there's nothing to be anxious about. That would be assuming that anxiety was rational. Anxiety is not rational, folks. It's irrational. The dog is panicking. Biochemically, this is as close to human panic attack as we get. The dog's having a panic attack every time you leave. Don't look for rational thought here, folks. The dog is upset. We need to find ways to convince the dog that you leaving is not a scary event. Not that you're not going to leave. The worst thing you can do, and this is what people used to try, is the dog's over there eating a biscuit. Honey, don't go out the front door. So you've delayed by 5 minutes, and then the dog is like, where'd everybody go? Maybe they went out that door. That's when they start to eat doors. Worst separation anxiety I ever saw was a golden retriever. Bless this golden retriever. They built a room. Talk about a padded room. They built a room for this dog with like latches because she would hurt herself getting out of crates. So they built like this room with Luan, and it was padded. And well, the teenage son forgot to lock the door. So the dog, you guys, none of you are too young to remember Wile E. Coyote. Remember when he would like hit a door and like you would see his like little body going through it? That's what their front door looked like because the dog ate his way through the front door. Got outside and then it started to thunder. Dog also had thunderstorm phobia. So instead of going back through the hole the dog had created, the dog decided to knock down the fence and go to the backyard where it found a sliding glass door and just proceeded to throw himself through that to get back in the house. 2 hours. They had no front door, no back door, and no fence, and a bloody dog. That's how bad these dogs can be. This is not, my dog cries a little bit when I go to work. This can be very serious, and that dog was panicking, make no mistake. That dog wasn't spiteful. The dog was truly panicking and needed help quick, because that dog was going to hurt himself. Dog did hurt. I got the call while the dog was in surgery removing glass and said, can you come now? Of course, these people, it took me about 20 minutes to figure out what they were asking me because the woman, bless her, she was from Staten Island, and she talked really rapidly, and I'm, my dog, and I'm like, where am I going? And she's like, well, you go down Richmond Ave and go to, I'm like, what state are you in? But they do, you know what? It causes anxiety in us, you know, pet anxiety, vet anxiety. Can you imagine if you own that dog and your son calls you and says, Mom, I don't think I latched the gate. You know, they rushed home at hyper-warp speed, and that's what they found. So it reinforced for both that there was a problem, and then the dog was like, oh, you're back. And then the next time they had to leave, the dog was even worse. So these things do cycle on themselves. Now, if we're going to start to treat the dog for this, how do I convince that dog that leaving isn't scary? I can't just say to him, don't worry, honey, you know, Mom's coming home. Behavior modification, here is the nuts and bolts of behavior modification. It takes a lot of time, it takes a lot of effort, and you have to go in minuscule baby steps. So whatever your end goal is, you have to break it up into teeny, tiny little, I don't think I'm doing a darn bit of good pieces, and work on it one piece at a time until it starts to make a difference. So if I have a dog who the owners can't leave without the dog hurting himself, I may have to teach the dog to be able to sit in the living room while Mom goes to the bathroom. How many of you have a dog you can't close the door when you go to the bathroom? Yeah, she's covering her face. You're raising your hand. Yeah, cats, dog. So imagine if you're a dog with separation anxiety, if you can't let Mom take a shower without being in there, how am I going to get him to accept you going to work if I don't teach him that first? I may have to work on teaching him to deal with separation anxiety inside the home before I can ever worry about outside the home. And that's what I mean. When we think about behavior modification, we all want to fix sort of the immediate problem at hand. You may have to back up and fix little problems before we get to the big problem. And so sometimes it's just you and I sitting down and identifying those. Common sense. So for separation anxiety, one of the things I do with separation anxiety is, I thought to myself, I said, self, what can I do to trigger a dog's memory that will stick? So clearly giving the dog the treat and leaving doesn't work, right? The dog either won't eat it because you're gone, or eats it at hyperspeed and then gets anxious. I can't just leave for 10 minutes at a clip because the dog will get upset every time you leave. What does a dog remember well? And I think about this, because I guarantee you, if your dog has separation anxiety, he knows when it's a work day versus a weekend day. He knows when you're going to work versus on Friday night when you come home and leave again. How dare you? You want to go out to dinner with your friends. Sometimes that's the worst they get. He knows the difference between the sweatpants on Saturday and the work shoes on Monday. He knows that you put on perfume when you're going to be gone for 8 hours, and you don't wash your hair when you're going to be gone for an hour. Dogs pick up on what we call departure cues. I can't get rid of all those departure cues. You know how many departure cues have been identified? 430-something, give or take. So if your dog has half of those, good luck. You know, walk around jingling your keys. That was what we used to tell people to do. You know, jingle your keys so he doesn't get used to the idea that keys mean you're leaving. Yeah, but you jingled your keys, but you're wearing your sweatpants. He knows you're only gone for 10 minutes to go for a run. You know, you jingle your keys and you have your work shoes on, it's a big problem. So I thought about it. I said, okay, we're doing this backwards. We're trying to get rid of cues. Let's create a cue. But let's dictate what the cue means. And for that, I use scent. Nothing dogs identify better than scent, folks. I teach dogs that if you smell scent A, mom is coming right back. And if she's coming right back, what don't you have to do? You don't have to worry. So, for example, say I use the smell of, I don't know, Glade, patchouli. So I teach the dog, if I go to the door and I go, shh, and I open the door and I leave and I come right back in and I go about my business, after about 20 times, your dog thinks you're nuts. She keeps going to the door and spraying Glade. What is she doing? But it's not unsafe. After about the 20th time, your dog looks at, oh yeah, there she goes again. Look at that, spraying Glade. But he's not worrying. The first time you did it when you opened that door, he was panicked. Now he's like, oh, yep, it's the Glade again. Aha, I gotcha. You know what that cue means now. It's safe. If you have to go to work on Monday morning, what shouldn't you do? Don't spray. You can't leave for 8 hours. It's not safe yet. It's only safe if you open the door and come right back in. So now I've created two different departures, a safe one and an unsafe one. If the dog understands there's a safe one, I can start to increase the amount of time you can leave with the safe one gradually. Meaning now maybe you can go to your mailbox and come back and it's still safe. If I go from 1 minute to 8 hours, I've lost my opportunity to use the scent. It's not safe anymore. I had one woman, bless her, she called me up, she said, oh my God, I have to get to work. I just sprayed the scent. What do I do? I'm just like at 7:30 in the morning. She's like panicking because she forgot she sprayed the scent and she had to catch the train to get to the city. I said, go outside, put your bag in the car, come right back in. It's an exercise. Go to the bathroom, wait 5 minutes, and then leave. Will he be anxious? Yes. But will you have ruined the cue? No. We developed this when I was doing my residency because we had a lot of working people who said they would do really well the first weekend. They'd get the dog going with gradual departures, but then on Monday morning they'd lose everything they did because now the dog didn't trust them again. This is a way of teaching the dog something they can latch onto and trust. And so will the dog be anxious for the first couple of weeks? Yeah, but you're working towards a solution. And in conjunction, we're going to do all the other things. We're going to talk about environmental management with you. We're going to talk about some of the behaviors I want you to change. We may, in some, like the dog going through the window, that dog I had to talk about medication. It was appropriate. The dog was hurting himself. So that's what I mean by behavior modification of the pet. I'm going to teach the pet something new, and I'm going to teach the pet, and it's going to have the desired result that I'm looking for. If I let the dog try and figure out what it means, he may get the right idea or he may not. I'm going to teach him what it means. And if it's safe and he can trust it and I leave it as trustworthy, yeah, he has 400 cues that aren't safe, but he has one that is. One note of caution if you ever try this, don't pick a seasonal scent. I had a woman in the winter in Ithaca who picked gingerbread, Glade, and got it at Wegmans, and she was like 90. And I said, please send your son-in-law to go buy about a case of it, because you're not going to get it after January 1st, and I'm not going to be done with your dog until the summer, and in the summer you're not finding gingerbread. So pick something that's commercially available, folks. You can still do this if you have sensitivities. I should add that. I like the aerosols because they linger in the air a little bit, but I've had people who have allergies. They use a scented candle. They'll use a sachet. I had one woman who used Dreft. She put Dreft on a washcloth. That's the kids' laundry detergent for people with sensitivities. It has a smell. As long as it has a smell, you can use it. Don't use something that you already use around your house. If you're a pine sol fiend, don't use pine scent. And I try and stay away from citrus scents. That's why we use citronella. It isn't a rewarding scent to dogs, and I don't want them to be like, ew, she's leaving. New anxiety. Okay. So now we're going to talk about modifying your behavior. Turkey on the head, yeah. My son loves Christmas tree shops. This is what he does in Christmas tree shops. He finds all the crazy hats and says, Mommy, take my picture. Okay. This is probably the area that's the hardest for me to convince people to do. Compliance is difficult. We have busy lives, and it's a lot of work to change what you're doing when you get a pet because your anticipation is that the pet's going to fit into your household. Sometimes it doesn't work that way, and you have to change what you're doing. Most people who rescue a pet want to fix the pet. right? You take in a pet who you knew had a terrible existence. You want to love it and make everything go away and make it feel better. And that's a wonderful emotion to have, and I totally encourage it, except be realistic enough to know that you can't do that in a week. If a dog is 5 years old and has been in a shelter for a year, things aren't going to get better in a week. You've got to be patient. Patience is the word that you have to teach people. It's hard to be patient. It's hard to feel like you're doing a lot of work and not making a lot of progress, which is why I encourage people, especially my clients, to keep journals. And I make people globally rate how a dog is doing. So I tell them, the worst it is right now is a 10. I want to look at your journal in a month and see that we're down to an 8. You may not feel like that's significant, but I can look back over 30 days and say, look at all the progress you've made. And if you're getting frustrated, I can say to you, but look where we started. Sometimes when you're living with it day to day, I speak from experience now, folks, I own Spike. It's hard day to day to live with a dog with behavior problems. It's frustrating. You love your dog, but it's frustrating. And sometimes you can't see the progress you're making if it's slow. But trust in the process that it's there, and it will come. The best thing you can do is make yourself part of the solution. And what I mean by that is if you have multiple people who live in the home, not everybody wants to be involved in this, right? A lot of times the dog latches on to one person or bonds with one person. The other person, either because of time or apathy, doesn't want to be involved. And what I tell people is that's okay, but don't be part of the problem. Either be neutral or be part of the solution. So, if I have a situation where a husband brings in the dog and he really wants to work with the dog and the wife's like, I'm not really a dog person, I don't want to work on it, just please don't do anything that's going to sabotage what we're doing. Stay neutral. So sometimes just educating people that, it's okay, you don't have to help, because people always think like everybody has to be on board and do all the same things. Not necessarily true. Just don't be part of the problem. So if I tell you to stay low-key when you're leaving and don't rile your dog up, if one person in the family does that, don't let everybody else in the family be like, oh, I'm going to miss you so much, goodbye, oh, I can't believe I've got to go to work. And then, because then the dog's going, wow, there's something to worry about here. That's part of the reason why when we do that, I think part of it sometimes is our own guilt. I'm leaving you and you're upset, and I don't want to leave you because you're upset, except that, I'd switch with them. They could go to work. I'll stay home, sleep on the bed, watch the squirrels. Don't feel guilty that you have to go and do what you have to do, but don't let the dog perceive that you feel that way either, because all the dog perceives is, my pack member is leaving and she's really upset, so I should probably be really upset too. It's not helpful. Now, one myth I would like to dispel. Bless you all. You guys listen to me, but sometimes you listen too well. When you come home, one of the things we tell people with dogs with separation anxiety is, don't make a big deal about coming home, don't make eye contact. I had one woman who, when she'd come in the house, said she did this. Hi, honey, I'm home. Because someone told her not to make eye contact with the dog. Right. You can make eye contact with your dog. You can say hello. Don't make a big fuss. Don't come in and say, I missed you so much. Because then the dog's like, yeah, me too. And tomorrow I'm going to be even more upset when you leave. Hi, how you doing? Why don't we go outside and pee? That's probably the appropriate response. I had a woman I could not convince to do this. And she said, but I feel so bad. And what I made her do, I put the hammer down on her. I told her, how far do you have to drive from work? She said, about half hour. I said, okay, this is what you're going to do. Because she's like, I know I have to do it, but I just can't. I said, yes, you can. Right before you leave, I went to her kitchen. I found a water bottle. I want you to drink that whole water bottle before you leave work. By the time she would get home, she had to pee so bad that she would whip past the dog and go to the bathroom, thus ignoring the dog when she came home. And by the time she came out of the bathroom and had to let the dog out, she was calmer. And she said, wow, that really worked. She said, but it was really mean of you. And I said, but did it work? She said, yeah, you were right. I said, did the dog suffer because you ignored him for 2 minutes while you took your high heels off? No. And so about a month later, the dog was doing better, and I get a call. She said, Doc, can I ask you a question? I'm like, can I stop drinking the water? And I said, okay, you can stop drinking the water, but here's the deal. Now, when you come home, I want you to have a pair of shoes that you change into, whether it's your slippers, your sneakers, your flip-flops, that you immediately change into when you get home, and I want you to keep them in your far bedroom. So you have to go right past the dog and go change your shoes before you greet your dog. Now, this dog was crated. She had a dog walker who would come in, but the dog was crated. So the dog couldn't follow her. It wasn't like the dog was like, grabbing at her leg and doing this. That 2-minute time to change her shoes, she would go and open the crate door. They were both calmer. The dog realized that she wasn't distressed when she came home, so the dog didn't become distressed. How many of you have ever been in a room with nervous people? Even if you're not a nervous person, after a while, don't you feel like, oh, it's kind of nervous? Room's tense. Everyone's looking at me like anticipate, like the room right now. Yeah, okay. These are things that we need to consider with separation anxiety. Punishment is probably, with any anxiety disease, the worst thing you can do to anxiety. If you're scared of spiders, anyone here have arachnophobia? And a spider were to be on the wall and you went, ugh, and I said, stop it. Does that make you less anxious? No, it doesn't. It makes the problem worse because now your support network is gone. These dogs, you're their support anchors, folks. They look to you emotionally. And if you're yelling at them because they're upset, it doesn't make them less upset. You know, my favorite was you'd come home, the dog has separation anxiety, you'd come home and you'd find the pee on the floor, so you'd bring them over to it and say, what did you do? Well, the dog peed. What do you think he did? Just clean it up and realize that the dog has anxiety and you have to deal with it. Yeah, I often laugh when we did that. It used to be with puppy training, we would, like, you know, if the dog pooped in the house, you'd say, what did you do? And you bring them to it. I often thought we were like leading them to the snack. Oh, look at that. Yep, that was me. That's not punishing. And all it does is create a position where the next time you come home, the dog sees you and goes, is she going to yell at me? And then what does everyone say to me? Yep, see, he knows what he did. Because when I come home now he looks at me and he's guilty because he has that look on his face. Well, if for 5 days in a row, every time you come home, the first thing out of your mouth is, what did you do? By the 6th day, the dog is going to start to react whether he did something or not, because his anticipation is you're going to yell at him. Smart creatures, folks. I mean the dogs. Okay. Quick discussion about pharmaceuticals. I say this in every consult I see. There is a vast difference between drugging a dog and medicating a dog. Please understand that. Drugging a dog is inappropriate. We don't drug a dog for our convenience or to dope him out to make him less anxious. It doesn't work. It's unfair, and it's not a good quality of life. If a dog, however, is suffering from an anxiety disorder such that he's going to hurt himself, and I can give him the appropriate medication to make him feel better while I do everything else, then it's appropriate. I will not give a dog a sedative for an anxiety problem. That's not fair. Can you imagine if you were really scared of something and you took a sedative just enough to be wobbly on your feet, but it didn't help your anxiety? Sedatives don't help anxiety. They make you slower. So now you're scared and slow and ataxic. She left. Oh my gosh, I'm scared. That's horrible. That's cruel. But if you can give an appropriate anti-anxiety medication where the dog says, okay, I can relax. I can catch my breath. Okay, it's all right. I'm going to be that's appropriate. And knowing the difference is appropriate. So when you have a frank discussion, or when I have a frank discussion with a client that, you know, your dog is really suffering from anxiety, if your dog had an ear infection, we'd treat it. If your dog has an anxiety disorder, let's treat it. I'm not talking about the first-time puppy who's a little cryy and whiny because you went to work. That's not the right pet for that. I'm talking about the dog whose quality of life is suffering. If I'm using the word suffering, then this is an appropriate discussion. Make sense? I hope everyone understands. You know, people laugh at me because I say I have this discussion with them and I talk to them about, you know, whether or not it's really appropriate to use, whether it's herbals or pharmaceuticals. And yet you look at, like, you know, my spreadsheet here. I mean, I probably prescribe more Prozac than all the other doctors combined because of what I do. I treat the dogs who are going to lose their home if I don't do something. When I'm in general practice, I very rarely reach for behavior medication. Rarely. Most dogs don't need it. It's the dogs who come to a specialty service because they've tried everything else who need it. Know your case appropriately. Okay, so we talked about that. One thing I should say, when I put a dog on medication for separation anxiety, it is fully my anticipation that he's going off medication. It is not a let's throw him on medication and leave him there the rest of his life. Also not appropriate. We are using it as a crutch to teach the dog to be a little calmer while I'm getting him to learn that it's not scary to be left alone. In this way, crutch is a good word. I need a crutch. Dog is suffering, want dog not to suffer. I take the edge off. I allow him to learn. And that's what it's about. How well do you focus and learn if you're nervous? Not very well. My son this week is taking the NJ Ask. If I tell you my son has an anxiety issue about testing, I'm telling you my son has an anxiety issue about testing. Mommy, it's going to be horrible. And they're going to da-da-da-da-da-da-da-da. I wanted to give him Prozac. I was like, honey, really, I promise you, you're not going to fail 3rd grade if you can't read the instructions on the NJ Ask. And he comes home the first day and he goes, well, that was easy peasy. I'm like, you created all that anxiety over nothing? He needed my support. He needed me to practice with him, change the environment, and he needed, we did a little bit of deep breathing, and the night before I made him go to bed early and I gave him a massage. I gave him a neck massage and with some lavender. That was enough. Folks, he didn't need a Benadryl. I mean, that's what we do to our dogs. If my daughter has febrile seizures when she was younger, she was on anti-seizure medication. She hasn't had one in 2 years. Guess what we're doing? Weaning her off medication. There is an end point to these things, and there should be. If you're doing the work, we should be able to get you off medication. Once you learn it's not scary for me to leave, if I remove the medication, if you've learned the lesson correctly, you're not suddenly going to be scared about it again. If you're scared of flying and you work your way through it, and you've been flying enough times now that it's not scary anymore, with or without the help of the little bottle, if you suddenly don't take your Xanax, you're not going to get scared again if you finally realize it's not scary. But if you don't do the work, withdraw the medication, problem comes back. That's how I know if behavior modification gets done. Once I remove the medication, has the dog improved? Because the dog should have improved naturally by learning. That's what medication does. It disinhibits anxiety so you can learn. Anxiety is a brick wall. Learning is over here, not learning is over here. Can I chink through the wall so the dog can do what I need him to do? Most of our dogs are pretty intelligent, Spike aside. Pretty mean. Okay. So this was a lecture I gave to veterinary technicians, but I want you to notice that I have a couple different classes of drugs, and then notice the 4th bullet point, herbals and nutraceuticals. I have them under pharmaceuticals. I use them all the time. For some dogs, natural remedies are appropriate, but when I suggest them, I treat them like medicine. They are medicine. You're putting a foreign substance into your dog's body. It's medicine as far as I'm concerned. It may be more appropriate, maybe less appropriate. It may be a good choice, but don't think because you bought it at the vitamin shop that it's any safer than the Prozac I prescribed for you. It's medicine. Treat it appropriately. Just treat it with respect. That's all I ask, because I do. Some of them are very good. Some of them I combine. I have a lot of dogs who are on medication who I also put on some of the nutraceutical supplements. For example, if I want to boost a dog's serotonin and I have him on one of the medications that helps with that, oftentimes I'll put him on see that 5-HTP? That's tryptophan. That's the amino acid you get in your turkey dinner. That's why you can watch like the Detroit Lions. That's why they can have the Detroit Lions on football on Thursdays, because we all ate turkey before, because otherwise they'd have to have a better team on. I'm a Ravens fan. What can I tell you? We won the Super Bowl, folks. So oftentimes what I'll do is I'll supplement them with a little bit of tryptophan. You know what tryptophan is converted to in the brain? Serotonin. So now with the medication, I've made the system work better, and I've given them a little more of the substance they need to work. So you can, this is not an all or nothing thing. Knowing what the dog needs and supplementing it appropriately is the way you make the dog better. What I do if I do that is very quickly I try and remove the medication, leave the supplement, and then a couple months later remove the supplement. So dog and cat, and I probably should have put human too. Dog and cat and human doses are not the same. Do not be alarmed. All right, cats take a lot less than dogs. Dogs take elephant doses compared to us. If you've ever given your dog antibiotics, you've probably shuddered to think what it would do to your stomach if you took that same dose, because we use a lot of the same antibiotics. If you've ever taken the same antibiotic as your dog, look at the dose. A Jack Russell Terrier, starting dose on a lot of these drugs, takes what I would take. Yeah, sure. You can use supplements with the drugs, without the drugs. You can do drugs without the supplements. You just have to decide what you're trying to accomplish and what the dog what his circumstances are. What was I just saying? What was I just saying? No, that's okay. Thank you. So when now that I've gotten most of the pharmacists in the area to stop laughing at me when I call in medication for the dogs, the dog needs what? Can I put you on hold? Yes, Dr. Kroll. was that Zoloft you were talking about? These dogs take, for example, Xanax. For those people who take Xanax to fly, an adult woman takes a 1/4 milligram tablet before she gets on an airplane. Okay? Dogs start at 1 milligram per 30 pounds of dog. So in a 30-pound dog, they're already taking 4 times what an adult woman takes. So I get a lot of phone calls from pharmacists and people freaking out. Oh, the pharmacist says you're going to kill my dog because you're giving him 2 milligrams. He's a Newfoundland. Not good. Probably because their livers just metabolize it quicker than ours. Again, we're all mammals, but our physiologies are different. Cats take half the dose of dogs, which is more in line with what we would take. So Fluffy the cat may be taking your dose of Xanax. Don't be alarmed. I promise you, I have the book. I have the drug book. I told a pharmacist once, he said, well, I looked it up in the human PDF. I said, you do realize it's, like the dog's name is Buster La Dog. And he said, but humans, I said, I don't have a medical degree. I have a veterinary medical degree. And I promise you, if you would like me to send you the sheet on what dogs take appropriately, I will. These guys take more than we do. They take it more often than we do, and they burn it off faster than we do. So this is my warning, and I know no one in here would do this. If you are of the human medical persuasion, do not self-medicate your dog. You're either giving too little or too much, and you don't know the difference. I don't medicate myself based on what I give dogs. I go to my doctor. Hard lesson learned. Right? I don't treat myself. It's not appropriate. I treat different species. I treat all species but one, the hard one. Okay. Last thing I'll say about medications, make sure that the cure is worse than the disease. If a dog is reacting poorly to them for whatever reason, he's having side effects, he's not eating, it's making him tense, he's shaking, he can't tolerate it, he has diarrhea, guess what we do? We stop. There is no reason to make a dog more miserable because I think it's going to make a dog better. Trying to make the dog's quality of life better. If I'm not accomplishing that, we do something else. That's when sort of the idea of maybe I have to go to something more natural to the body versus sometimes the tryptophan, some dogs get terrible diarrhea from it and can't tolerate it. I know it would be a good thing for them, but if they can't tolerate it, it's not a good thing for them. So beware, anything can be altered and changed if it isn't good. So let's talk quickly. I know, I talk quickly anyway, and I talk. Let's talk about some of these other modalities and some of the equipment I use for anxiety. So I get asked about this one a lot. Now, this was my pound puppy from when I was a child. I still have it. And that would be thank you from my mother, who has like the box of, I was an only child. She has the box of Tracy things. And that was so can you see what he's wearing? He's wearing a Thunder shirt. Except he's not really wearing a Thunder shirt. He's wearing a doggy jacket from Target that cost me $1.50. And but people ask me about proprioceptive shirts and Thunder shirts all the time for anxiety, even separation anxiety. And this is what I'm going to tell you about things like Thunder shirts. They work for some dogs. They work for the same dog who likes being held really tight to you when he's nervous. They work like a baby likes swaddling. Some babies love it and respond to it and are calm by it. Others kick you in the head when you try and do it. Know your dog. If your dog will be helped by it, it will not do any harm and it may help. Now, what I would recommend, however, is that you try it with something other than a $40 Thunder shirt before you invest in a $40 Thunder shirt. They're expensive, and they don't have any magical properties to them. They're shirts. That little lining in them, the little silvery lining, it doesn't have magical powers, I promise you. If you go to the pet store, my $40 million industry again, if you go to the pet store or the dollar store or Christmas tree shops and buy a t-shirt or a little jacket, a half a size smaller than you'd normally buy, you will have a proprioceptive shirt on your pet. It will serve the same purpose. If your dog responds to it, your dog responds to it. Use it. Thunderstorm CDs are for another lecture, obviously. We don't use those for separation anxiety. Pheromones. A lot of people ask me about pheromones. Yeah, go ahead.
Sorry, just about the proprioceptive shirts. Is there any danger, if a dog is freaking out when you
If you have the dog who will eat it, don't use it. Yeah. You know, if you have the dog that you can't put a mat in his crate, then a thunder shirt is probably not a good choice for you. Yeah. To thine own dog be true. Okay. You know, I mentioned my own dog. What I did when people come over is I used to give him greenies. I mean, you know, greenies for some dogs are like as evil as rawhide flips used to be. But remember, I have a little terrier. He's like a typewriter, for those of us who are old enough to remember typewriters. Bing! There was nothing left of the greenie when he's done. There's nothing to swallow. I would never, I had a Samoyed growing up, I would never have given her something like that because she would have taken a chunk this big, bit it off, and swallowed it. So you have to know your dog. Absolutely. It's a good point, though. Thank you. Pheromones. Feel away on the right. That's DAP on the left. DAP is the dog one. People ask me all the time, do they work? And I will tell you that as one small portion of a whole treatment, for some dogs, they help, right? For the new puppy coming into the home who's a little nervous because he's never been away from his litter, they probably work better because that's really what they're for. What I will tell you is, though, that those diffusers are meant for one room each, which means if you're going to use them and your dog lives in your whole house, you have to have a diffuser in every room. If anyone's ever priced diffusers, they are not cheap. So if you're spending $30 a diffuser and you have 6 rooms in your house and you have to replace them once a month, you're probably not going to, for a separation anxiety dog, get enough effect from them to make them an effective tool. If, however, you have a puppy who it's the first time in his house and you have to go to work and he's a little nervous and you want to plug it in right near his crate, because that's where he's going to be spending all his time and you're going to use it for 2 months, that's a $60 investment. It's probably worth it. They were developed by the French. And the idea is, the DAP especially, it's a synthetic created chemical that's supposed to mimic the pheromones that they get from mama while they're suckling, that they smell on mommy, so it's supposed to have a rewarding feeling. Again, back to scent. Scent's very important to dogs. There are ways to do that. They're a little less expensive. We'll get to that in a minute. You know, you can see my house is filled with multiple types of gates because I could run around my house taking pictures of gates. I use them to keep dog out. I use them to keep child out. Protect your dog, protect your child. Okay, this is Spike's crate. It's a soft crate. I don't have one of those hard ones for him because he needed a little space to feel safe and secure, and it needs to be dark and snuggly, and he needed blankets all piled up the sides because he doesn't eat them. Every dog is a little different. Some dogs like to be able to look out. Some dogs don't. Be careful with the wire crates if you're going to cover them because some dogs will drag the blanket in and eat it. And also be careful with wire crates because some dogs will try and chew their way through them. So you have to, if you have a dog who's self-injurious, be really careful about crating. You may be better off trying to use a room and, you know, finding a way to restrain the dog that way versus a crate, because I have seen dogs really hurt themselves trying to escape crates. So just know your dog. If your dog is the type that's going to be a Houdini. I mean, I've come into people's houses. How many of you have either used a carabiner on your crate, have bought those zip ties at Lowe's to secure your crate, have had to use duct tape to fix your crate? I mean, these dogs, I had one woman, she went and bought, like, you know the little, like, they look like zip ties that you use on, like, garbage bags, and she bought them in, like, multicolors, and they were like all around the crate, like on all the seams, and you could see the dog was chewing them away one at a time, and every night she had to go through and put new ones on. I do not want to see what color dog that dog's poop was. Rainbow colored. Okay. $1 million question. Guess what this is? It's one of my favorite things I ever found at the dollar store to use to treat dogs. It's a battery-operated doorbell. So for dogs who are anxious about people coming to the door, you know, we used to tell people, like, run around the back of your house and come to the front and ring your own doorbell. Of course, your neighbors think you're nuts because they see you running outside your back. Honey, go ring the doorbell again. And you're like, running outside. So now you go to the dollar store and buy a battery-operated doorbell, and it records. You can record your own doorbell sound. So you can very discreetly hide it and ding dong, and then if the dog gets nervous about it, you can desensitize him that way. Similar idea to the scent cue, but using a sound cue. Okay, so this is my alternative to DAP. I love lavender for dogs. There is a reason why lavender is put in baby products, why lavender is put in aromatherapy products, why lavender is put in massage oil. Lavender has a direct effect from the nose to the cortex of the brain, and it has a calming effect on most mammals. So if DAP works, lavender will probably work. Now, you cannot go to Target and buy lavender-scented Glade. That doesn't work. It has to be real lavender. So you do have to kind of buy the good stuff. Or you have to grow lavender. I have a lot of people who just end up buying lavender plants because it works. I use it for two things. I use it on dog beds and in crates if I have a very anxious dog, especially when they're traveling to the vet. I'll have people put it in the crate because it's calming. And I use it when I do massage at the other building. Anxious dogs are very tense. Their muscles are very tense. They tend to be shaky, and everything is stiff, just like us when we're tense. Massage calms them. Think about it. If you're tense and somebody comes and rubs your shoulders, do you feel better? If somebody did it and it's a little bit of lavender, and turn on a little soft music, and you take a bubble bath, relaxing, same for the dogs. That's why we started a massage therapist. I actually have my CCMT now. I can add a few more letters to my name. I am a certified canine massage therapist now. And I did it because, not because I cared that I had 4 more letters after my name, but because I really wanted to do something for anxious dogs that didn't involve necessarily medicating them. For some of these dogs, teaching you where your dog's pressure point is that will help him relax is a real benefit because it gives you something you can do. If I give a dog a massage, I can find where his pressure points are for you. And I can say, you know what, if your dog's really nervous, this is the place where he comes down the most. Rub him like this right here, it will help. And it does. I mean, there is something to touch, right? That's why we pet our dogs. That's why, yeah. I've never done it on cats because I've never had a cat stay still long enough for me to do it. I would imagine it would work the same way. I've used lavender in their cages, but I've never massaged them. My own cat looks at me like, you are cray. If you think I'm going to sit, like she'll let me rub her scruff for a few seconds, and then she's like, yeah, thanks, bye. She's young, what can I tell you? Yes. No, I actually did equissage, which is a sports medicine. It's like a deep muscle massage. It was originally developed for therapy dogs, or dogs who need therapy, not dogs who do therapy. So for like rehab, for orthopedic problems, for elderly dogs with arthritis, that's what it was originally meant for. But then we all suddenly realized, wait a minute, nervous dogs would benefit from that too. That's why I did it. I took the sports medicine class to learn how to do it, but I use it on my anxious kids. And I think it really does help. Plus, it also desensitizes them to being handled and touched. So if I have a dog who's not good about like getting his nails trimmed, a lot of times if we do massage enough times, I can start to work my way down their legs and get them used to having their toes handled. Similar. Same idea. I mean, same idea as acupuncture, really. Anyone ever had a cat where they picked up by the scruff of the neck? You know, everyone who doesn't know cats always thinks, oh my God, that's so cruel. You ever seen what a cat does when you do that, especially a kitten? They do that. You know why? We release endorphins. That's a pressure point in cats. So that's why kneading their scruff tends to make them relax. So you can find that point in any animal. You just have to know what point you're looking for. So that's a way to reduce anxiety. The problem is you have to be there. So for separation anxiety, it's hard to use that as a modality to treat the separation anxiety directly because you would have to be there when he was anxious, and when he's anxious is when you're not there. What it's good for is, however, it gives, especially you guys, something to do when you get home and the dog's been tense all day long. It's a bonding time to you that will help the dog relaxing and prepare himself for the next day. So that's what I use it for with these guys. So there you go. We talked about that. See, this always happens to me when this is why I don't like PowerPoint. I have to look up because I realize I'm always 2 slides ahead of where the slide is, and I say, oh yeah, I said that. See, I said that too. Okay. All right. So for any dog with anxiety, any anxiety, but specifically separation anxiety, we need to identify what about your departure is making the dog upset. All right? So we need to identify the triggers, and we need to identify what the dog is doing to exhibit anxiety. We need to find out, is it a transitional anxiety, meaning a new dog just adjusting, or is it a true anxiety disorder? The way we do that, does your dog have a singular anxiety, or are there multiple anxieties? Multiple anxieties tend to indicate an anxiety disorder, right? If the dog is a shelter dog and he's been in your house for 2 weeks and he's a little nervous because you're leaving, but overall he's pretty sound, might be transitional. But if your dog is also scared of thunderstorms and doesn't like strangers coming to the house and now is really upset when you're leaving, we probably have to address anxiety. After we address it, I break it into those 5 groups. I treat the pet, treat the environment, educate you, discuss pros and cons of adding something in, and see if there's any additional modalities such as using gates, changing space, massage, lavender, DAP, thunder shirts. See if there's anything else appropriate that will treat the problem. And I will tell you about separation anxiety. One of the #1 reasons it succeeds is you throw everything at it at once. Many, many people come to me and say, but I tried that. No, but I tried that. But I tried that. And then after that, I tried that. You tried it one at a time. Well, these dogs are severe enough that one little thing at a time, just using DAP didn't work, okay? Trying departure cues, no, that didn't work. I tried that for a week. Nah, I gave him a little Clomicalm, that didn't work either. But if you do it all together as a comprehensive treatment plan and get the dog so that he feels better quick, you are much more likely to make gains. I'm going to stay, I have this feeling I'm going to be staying for a while, and that's fine. If you all have questions, please feel free to stay. Let me add, if you need to leave, none of us will be offended. Please go. Thank you so much for listening. If you have questions, I open the floor. Yes. No, I actually did it at home. Yep, they have an at-home class. Yeah, I couldn't get all the way to Virginia. My kids would not have tolerated me being gone. They would have had anxiety. I think my husband would have had separation anxiety because he was left with the kids, actually, is more probably like it. Yes? Okay, we're talking about a foster dog with severe separation anxiety. German Shepherd. Now she's deaf. Mm-hmm. Eats blankets, eats poop, eats anything. I'm paraphrasing, folks. Mm-hmm. Crate's ineffective. Mm-hmm.
They were suggesting maybe sending her to doggy daycare during the day, and that would help.
Mm-hmm.
What are your thoughts on that?
Okay, so the question is nuts and bolts. My dog just can't tolerate being alone right now. What are the pros and cons of doggy daycare? Having somebody come in to see your dog or having your dog go to someone eliminates the issue that he is alone. If your dog isn't purely just looking for you, but is anxious about being alone and will be distracted by the other dogs to play, then doggy daycare, if it's safe and appropriate, would be a wonderful tool. Many dogs, I will tell people in the beginning, the less you have to leave them alone, the better. But some dogs are looking just for you. This is why I don't recommend, as a rule, getting a dog for your dog with separation anxiety to fix the problem. Now, somebody is going to raise their hand. No, none of you guys, but someone would have raised their hand and said, but my dog had separation anxiety and I got him a friend and it went away. Yeah. For some dogs, any companionship will fix the problem. That's about 40% of the dog's separation anxiety will be helped by having a canine companion. That means there's 60% of the dogs, so you have now adopted a second dog and you have a dog with separation anxiety because you are not there. So if you want to get a second dog, because you want to get a second dog, having a dog with separation anxiety shouldn't stop you, but be aware that's a pretty long-term commitment to make as a less than 50% treatment option. I tell people all the time, as a rule, don't get a dog for a dog, don't get a dog for your children, because really you're getting a dog. If you want to take on that responsibility, what I recommend, if you want to see if it will help, have somebody bring their dog over for a couple days and see if your dog gains some sort of comfort from it. If it works, then maybe it's an option for you. But if the dog is like, okay, now I'm really, really, really nervous, and yeah, Buster's over there, but Mom's still gone, then it didn't work.
She did have another dog. I think the fifth foster.
Mm-hmm.
She did grow up with her brother who used to attack her.
Mm-hmm.
Was okay with other dogs, went to live with somebody else who had dogs, but then they created her and she was alone all the time.
Mm-hmm.
I got her April 13th. If you would have had I find it very hard to believe from the damage that she's caused in my home that
Yeah, here's the long and short of that. When you have a dog who has rotated through home after home after home, there's a reason why he's rotated through home after home after home. It's probably because somebody couldn't or didn't, no judgment there, address the behavior problem. Sometimes you can't address or the environment wasn't appropriate to address the problem, or maybe they were managing it successfully enough that it wasn't a problem until they couldn't take it anymore. My guess is, though, that your dog right now, another dog is not enough because your dog's suffering from anxiety. If I have a child with anxiety, just having a friend over is not going to make my child less anxious. It may distract them for a while. That's why doggy daycare probably works. They're distracted. They're having fun. It tires them out. I mean, there's a whole host of really good reasons for it, but you still have to do everything else. Mm-hmm. If it's appropriate for if your dog is healthy yeah, I use them all the time. Remember, some of those drugs up there are long-term general anti-anxiety medications. Some of them are short-term acute. And so knowing which ones you can combine, you can, because sometimes a dog needs something to lower the anxiety and then needs something right when you leave. You just have to know what you're doing. That's all. That's 10 years of college. Yes. Mm-hmm. Mm-hmm. Right. So what I have people do is, so the first weekend you're going to start it, the first thing you've got to do is teach the cue, right? So you're probably going in and out of your house for 2 seconds at a clip, like 20 times until that little Edison light bulb goes off above the dog's head. So you write down in your little logbook, can leave 20 seconds. Then during the week, maybe you can do it once or twice while you're at, when you come home, you got to bring the garbage out. You'll use that as the time you go. Just keep track of where you left off last time in your log. So if you have to go to work 8 hours, is he going to be nervous during those 8 hours? Yeah. I mean, that part is not going to change. But you haven't lost what you did before. If the next night you then do it for 20 seconds, it should still work as long as the cue is the same. So then after 5 or 10 times of leaving, going, bring the garbage out, if that then becomes yep, she's still crazy, she's still spraying it, but she's still coming right back, then you leave for 10 minutes. Then we start to increase it incrementally. Once you get out to about an hour, most of these dogs are pretty good. That's why you have to add some sort of very discreet cue. That's why we use the scent, because yeah, you're right. What people would often tell me when I was up at Cornell doing my residency, what people would tell me is on Sunday, we did it like 10 times, and by the 10th time he was doing great, but Monday morning he freaked out and ate my house. Well, yeah. Because you didn't teach him, you taught him good over the weekend, but you didn't give him any distinction, and then the rules changed suddenly. So it became scary. And then you're starting from, time 0 again. Yes, my dear. No, I'm not. Because I don't want that to be safe. It's not. And that's where human patience has to come in. It's horrible doing it over the weekend that first time and knowing you made some progress and then leaving Monday morning and saying, all right, I'm not going to spray it and I know you're really going to be upset. That's really hard to do. But ultimately, long term, that's what helps. Mm-hmm. Most dogs, if you're going to have a panic attack because your owner is leaving, most dogs within the first 30 or 40 minutes is when you're going to have your most extreme panic behavior. Most dogs, if they're calm for an hour, aren't going to be like, wait a minute. She left an hour ago. She's not coming back. I mean, most dogs by then go to sleep. I mean, let's face it, what our dogs do when we're not home. Most of them, you can find the butt print on your sofa, especially if they aren't supposed to be up there, right? And they sleep. And they wait for you to come home so they can save all of that energy for you. Right? When you have Jack Russells. Okay, yes. Dogs, we think, have a sense of time sort of conceptually but not specifically. For example, dogs can tell the difference between she ran out for a quick trip and she's gone, but I don't think they know the difference between, say, 6 hours and 7 hours. So one thing I will tell you, I had a dog, and I'm sure everybody has had at least had something like this happen. I had a dog growing up that at 5:45, she would be near the door because she knew my dad's car was going to be pulling up at any moment, right? You know, so there was, and I think that was a lot based on light cycles. She knew the sun was starting, you know. So there is some concept they clearly get. I mean, I don't ever like to discount what dogs get because I think we do that too much. I think dogs get a lot more than we give them credit for sometimes. But I think it's appropriate, like, you know, we always assumed dogs were completely colorblind. Not true. Dogs see color, they just don't see it in the same spectrum we do. And I think the take-home message there is dogs, cats, people, we see things through our own lenses, right? Dogs see things the way a dog should see them. We see things the way we should. Doesn't mean it's right, wrong, or indifferent. It just means it is what it is. So I try, you know, to treat the dog, be the dog. It's very zen. Yes?
Hi. I heard somewhere, and I've been doing it, but I'm not sure about it, that it's that dogs are less anxious. Like if you take them in, if you have to like go to the store or something, take them in the car and then leave them in the car as opposed to leaving them alone at home. And I'm wondering what you think about that.
Well, there are pluses and minuses to that. The question is about bringing your dog with you, like when you go to the store and you're leaving him in the car. Well, you can do that until June, May, and then you can't do it unless you leave your air conditioning on, and then you know you have the thing where invariably one of you is going to tell me your dog has locked you out of your car. Because click, yeah, that would be my dog. Yeah, I'm sure that would be like Spike because he'd be panicking. He like hit the lock button. That's why we all have fobs now. It's for our dogs. I think if your dog is never left alone, and that's part of the reason he has separation anxiety, in the beginning you want to take him with you while you're working on it, but if he always comes with you, he's never going to learn to be alone. I mean, if that's part of the issue, so you have to know your own schedule. If you work a lot and your dog has anxiety on the weekends, by all means take him with you because he probably needs some you time. But if you're retired and you're home all day long, I'd start to get him used to being alone for short periods of time. So, you know, if you're running to the bank, you know you're going to be gone for 15 minutes. If you're up to that point, I wouldn't take him with you until he's because one of the things we find is the dogs that have the hardest time getting over this are dogs who have a stay-at-home person at home, like a stay-at-home mom. They're always home, or retirees. If you're a homebody and you're always home, what does the dog have to get used to? And then you want to leave, it's even worse because now the dogs used to have, you know, I used to work from my house. It's a good thing none of my dogs had separation anxiety because then when I come down here all day long, they'd be, you know, panic-stricken. So you have to be a little careful. It's not a bad idea if you're working on the problem, but be aware that if the problem is that you guys are kind of attached to one another, you've got to break the bond a little bit.
And do you think that a 16-year-old dog would be able to learn?
If a dog has a brain, a dog can learn. I don't buy this old dog new tricks thing. They learn slower. I mean, heck, I learned slower than I did when I was 16. You know, our coping skills go down. Now, keep in mind, I tell people, when you have a dog that goes from age 2 to 10, that's like us going from 18 to 40 or 50. So, you know, for us, it's like every decade, sort of the coping skills go down. What could you deal with at 20? What can you deal with at 30? What can you deal with at 40 and beyond? You know, I'm 40 right now. What I could deal with in college, the all-nighters I used to pull, I don't know that I could pull anymore, right? A dog's life is condensed into, you know, knock on wood and being happy 17 years. Those coping skills go down pretty quick. By the time you hit 7 or 8, things are going down fast. So a 16-year-old dog is not going to learn like a 2-year-old does. It's going to be harder to teach the lessons. It's going to take a lot more patience, and it's going to go slower. But they can still learn. I mean, I think that's the disconnect. You know, we kind of think a dog hits a certain age and they're not going to be able to learn anything anymore. Not true. Just respect the fact that now you have an elderly dog that has to learn, and you've got to have some limitations. That's all. Yes?
My mother-in-law's 90-pound standard poodle.
Uh-oh, we're talking about the mother-in-law's poodle. Okay.
Both now deceased, so this is
Okay.
the second one.
Mm-hmm.
He would lunge at and bite
Mm-hmm.
not just her. You get the DirecTV repairman, several of her friends, and my husband, and those are just the ones that are pervasive. Would you consider that separation anxiety, or is that a separate type of trigger?
Okay, so the question is, if a dog is, good night, if a dog is responding aggressively to people leaving your house, not coming, but leaving, would that fall under the category of separation anxiety? And the answer is probably not, but I have seen dogs who have separation anxiety who tend to do that more. So there are many dogs who they don't like people coming and going out of their territory. It makes them tense to have all that movement. They don't like the door being jostled with. Those are a lot of reasons a dog can do that. Some dogs do it. If you ever watch herding dogs, they'll do it like they'll bite you and be like, and don't let the door hit you on the way out. They're actually trying to bite you out the door. So it's all in context. So if a dog is, I mean, if it's your own dog and you're leaving and your dog is biting at you, they're probably trying to pull you back in. Like, don't leave. Yeah, I'm going to bite you if you leave, so probably you want to stay. It's convoluted logic, but maybe it works. Well, I can't leave. My dog might bite me. I've heard stranger. But probably that was more of a learned territorial type behavior, especially if it was the DirecTV repairman. Right. He would, of course, never do that to anyone who worked for UPS. I know he wouldn't. My husband works for UPS. See, what Brown is going to do for me is send my son to college, so I have to be very respectful of the fact that UPS men shouldn't be bit. FedEx, the mailman, keep him away. But UPS, Brown is good. Okay, yes. What, hating UPS? No. Yeah. So if your dog bites guests leaving the house, guess whose behavior should change first? Yours. Keep your dog from biting people. If you know you're, I mean, I would imagine if your friends aren't functional mutes, they will say, I'm going to be leaving now. That's the time to put your dog on leash and not let him bull rush your friends. Right? You have control of that situation. You know what? You know when that happens a lot? A lot of times dogs who are very fearful, you'll get your friends, you'll get them all gathered in your living room, and you'll get them to sit down, and then you'll let your dog in, and your dog will be okay until they have to use the potty. Then they stand up, and they come back in the room, and it's like they haven't even been there, and the dog starts up all over again. So the answer is, what do you do? Well, the answer is, if your friend says, you know, need to use the little girl's room, grab your dog. You know, I actually, much like my airlock thing, if I have people who have an open floor plan who do that, I tell people, get one of those like super gates like the babies have, put it around your door. Let people go into that little vestibule area before they leave or come. Don't let your dog do that to people. But you may have to physically control it. Because that can become, not only is it a behavior problem, they're doing it for a reason, it can become a bad behavior habit. And there is a difference between a behavior problem and a bad habit. But behavior problems can lead to a lot of bad habits. How many of you have ever seen a dog, it wouldn't be your own because you wouldn't do this, who is a puppy who the owner says, it's so cute when I come home, he jumps up on me to say hello, except that he's a Great Dane puppy. And someday he's going to weigh 130 pounds, and guess what? When he's a year old, he's still going to do that. It's not so funny anymore when he's knocking you over. Or, I mean, I've seen it a lot of times with labs. You know, the little lab puppy looks like Marley. I pick him up. All of a sudden, he's 80 pounds of pure muscle, and he's bull rushing people at the door and bang, knocking into you. It hurts. Or an Akita. It's a habit. You know what? We let little dogs and puppies get away with it. Now, if you're a Shih Tzu and you do that, you are never going to be more than a knee-level Shih Tzu. And if you tolerate it, it's not a behavior problem. It's a bad habit. You can choose whether you want to address it or not. Dogs can lick me despite, you know, what they put their nose in until they're blue in the face because so few of my patients can come close to me. So when they can, I encourage it. Please come kiss me. You like me. You really like me. I don't like dogs scratching me. I don't like dogs jumping up and raking me. Personal preference. So if I have a dog, I will let my dog kiss me all day long. Some people are like, you know, like they don't like it. I don't mind that. So if I had a dog who was a chronic licker and someone came to me and said, is that I hate it, my dog licks me, I'd say to them, okay, but that's a habit we need to address. It's not a behavior problem. A behavior problem is, my dog is hurting himself trying to escape the crate. A behavior problem is not, all my dog does all night long when I'm home is kiss me, kiss me, kiss me, kiss me. And I'm thinking, yeah. It's the same thing. I had a woman the other day who called me in tears and said her trainer told her, because her dog was a light chaser. You ever, but was a compulsive light chaser, like to the point where the dog wouldn't do anything but chase light all day, like shadows all day long, wouldn't eat, wouldn't sleep. It was really pretty severe. So she called her trainer and said, I have a behavior problem. He said, get that dog off the bed. I said, okay, why? She said, well, he said he has a behavior problem. That's what you do. So somewhere this guy had read, you have a behavior problem. You shouldn't let your dog on the furniture. I said, but how does that fix the problem? She went, I don't know. Well, it turns out the reason the dog had gotten severe was because 3 weeks previously her husband had suddenly died of a heart attack. So now her husband was no longer in the bed, and the trainer just kicked her only means of emotional support off the bed. And the dog and the woman were suffering. She said, what should I do? I said, get that damn dog back in the bed and snuggle the hell out of him. That's what you should do. Was it a behavior problem that the dog was in the bed? No, that was her choice, and it was a good choice for her. Don't make problems where there are none, folks. Don't read the internet and let somebody tell you what you should or shouldn't do if it's not a problem for you. You know when a dog being in bed is a behavior problem? When he's biting your face. Then I tell you, get the dog. No, I'm serious. You know the dog who won't let your husband back in the bed after he's been to the bathroom? That dog shouldn't be on the bed. I had a dog like that who, if my husband got up and, I was the wanderer, but if I try and get back in the bed, he'd growl at me. I bought that bed. You're off the bed. But if not, it's your choice, and it's not a behavior problem. Don't create problems where there are none. And don't let anyone tell you how to treat your dog based on some general web. We treat your dog specifically based on your environment, your lifestyle, your family, and your dog. If your dog likes Spike, I've had to make a lot of allowances. I mean, I joke about Spike, but truly, I've made a lot of allowances for him that I wouldn't do. I would never have tolerated a dog peeing in my house. You know what? He's 17 years old. I clean it up. My mother, bless her heart, is Felix Unger, and it drives her crazy. And she's always like, your house stinks, and your kids have to live. Mom, he's 17. And you know what? When he passes away, we're going to get a puppy, and guess what? I'm going to have to potty train it. I was like, you do realize your only child is a veterinarian. She's like, you never smell anything. I'm like, I couldn't survive working in a veterinary hospital if I was that sensitive to smell. Are you kidding me? I mean, have you ever been in a shelter, Mom? We did have dogs growing up, didn't we? Of course, this is the same woman who would vacuum and then apologize to my friends for the house being dirty, and they'd be like, Trey, you could eat off your floor. We'd have Samoyed. But, the point is, Spike has led to some unique changes in my life. Profound ones, and good ones, too. It's taught me how to be empathetic to people who live with a behavior problem. It's hard. I don't live the life of a normal dog owner. When I had 2 dogs and I had a baby, I used to take my older dog with me to the park with the child, and I had to leave Spike behind. People thought I was the meanest, because Spike would be in the window. But you know what would happen if I brought him to the park? He would tangle himself up in the wheels of the stroller and try and bite somebody. Spike never goes for walks. People think that's horrible. Oh, you don't walk your dog? He needs exercise. I have a fenced-in backyard, and every night until he was about 12 years old, I would go out for an hour and play fetch with him. He got an hour's worth of concentrated exercise every night. How many people can say they walk their dog for an hour every night? Okay, I never walked my dog, but my dog got what he needed. I, in fact, I have a chain link fence, had to put a triple bar on the bottom so he'd stop going under the fence into my neighbor's yard. I did it. I changed my environment, I changed my lifestyle, and I changed my behavior. As a veterinarian, I always said, dogs got to go for a walk, they need exercise. No, dogs got to have exercise. You know what people in Manhattan do with their little Yorkies to get exercise? They have those, their hallways kind of look like bowling alleys. They play fetch in the house. They don't leave, and they still get exercise. You know what some people do? They buy treadmills. They run their dogs on the treadmill. It's exercise. Know your dog's needs and meet it. It doesn't have to be what someone else says you need to do. It has to be what your dog needs that makes you and your dog happy, period. I'll help steer you. I'll tell you you're a little woohoo. I told one woman And she and I have since become very good friends. She was a client, and one time I couldn't control myself, which, as you can probably tell after tonight, sometimes it happens. She asked me like if she could do something. I'm like, that is cuckoo for Cocoa Puffs, and she was like, we're very good friends now. But it was. She wanted to I forget what it was. She wanted to build something. She wanted to build a dog house inside her house so the dog would feel like he had his own real estate. There was this whole, and I was like, dog concept of time, maybe concept of realty, not so much. And I'm like, get him a dog bed. She's like, but wouldn't he feel better if it had walls and structure and I could put some electric? I'm like, no, not really. Not really. Cuckoo. I'm like, find something. Donate that money to a shelter. What? Yeah, he's Spike on top of the Akita. And Shaggy Doo coming over to me. Oh, don't worry about it. He's not aggressive. That happens. How many of you have ever been at a park and you see the dog off leash coming towards you and your dog is the aggressive one and you're sitting there and then someone says, oh, don't worry, he's fine. And you're like, yeah, but mine isn't. And mine is about to drag me towards your dog's death. It's you can control, but so many things in your own environment, you cannot control the X factors outside your environment. And sometimes we have to accept that. That's why Spike didn't go to the park with us. I can't control kids running up to me. I can't control bicycles going by. I can't control people who don't control their dogs or let their dogs walk on flexi leads, which none of you do, I'm sure. We don't use flexi leads because Dr. Kroll likes her ankles without rug burn. You know what dogs do on flexi leads? They tangle around Dr. Kroll, then they pull, and then I go flying. Those flexi leads are horrible, folks. You have no control over your dog. I watched a dog die running into the road on a flexi lead. He was on leash, but he ran 25 yards out. I mean, the owner couldn't stop him. Coincidentally, sometime late in June, you'll probably be hearing about this, especially if you're on our website, the borough of Red Bank is having a Bring Your Dog Out night. Has anyone heard about this? Some of the outdoor cafes are going to open, and they're going to have doggy menus, and you can bring your dog that night to have dinner with your dog, and then they're going to close part of Mama Street and have like a dog fair. So, but Dr. Kroll is the head of the Pup Patrol. We will be there in bright T-shirts watching you all. No flexi leads allowed. Your dogs must be appropriately rabies vaccinated, and we have the right to kick you out if your dog is not well behaved. Other than that, it's going to be a lot of fun. And there will be, we will have people at every, major location in case you have questions or you have concerns, or if another dog is misbehaving, so you have somebody to go to. We want it to be a fun event, but we want it to be a safe event, and that's kind of what reminded me of that. Having a dog is a wonderful way to sort of interact. It's like social networking, right? It's like Facebook, when you have a dog. But if you have a dog that is antisocial, don't try and force sociality on him because you're just going to get somebody else hurt. Protect your dog. Like Spike. It was as much to protect Spike as to protect somebody else. All I needed was Spike to bite somebody. Can you imagine, here I am in court, and the judge says, what do you do for a living? Well, I'm a veterinarian who teaches people how to protect people from what happened? Yeah, my dog bit somebody. That'd be terrible. I knew Spike would. It was inevitable. He would bite. You know what he used to do when people came to my house? He would try and bite their ankles, and then he would pee on himself and run away because he's fear aggressive. But a bite is a bite, folks, and no one cares why he did it other than me. I didn't let him get in that situation because he's a poor decision maker. I had to be the decision maker. 17 years, and I've never had a dog bite from him other than, within the family. And I blame my father for that because my father's the knucklehead. Sorry, Dad. My dad's deceased. But my father was the knucklehead who came in my house and said, oh, don't worry about it. All dogs like me, except Spike. Spike nailed him. Because my father, no, don't put him away. All dogs love me. My dad left with a piece of his calf missing. And you know what I said? Dad, it's your own fault. My father, who owned 3 American Staffordshire Terriers, couldn't handle one little rat terrier coming at him. Ha ha. I was like, Dad, that's like running into a plate glass window every day. Love you, Dad. Yes.
I just want to elaborate one more time. This dog, I can't even go in the bathroom without her. I can't get a shower without her.
I was so glad when I outgrew the phase where my kids didn't have to have the door open, and now my damn cat comes with me everywhere. I'll be in the shower, all of a sudden I'll see the paw. Is there no privacy in this household?
Even when I take her around a huge backyard, like we're doing in the yard, she won't stay in the backyard.
Yeah.
Jump on the fence, she'll bark, cry. So even when I'm with her in the backyard, she won't leave my side. I have to literally walk her on the leash. So I try, I'm a neurovector for 10 years, go on the other side of the fence just so she can see me. She can still see at the fence.
Mm-hmm.
I'm living almost there, right? So then she won't go to the bathroom. Then I stood out there with her for 2 hours.
Mm-hmm.
And then she'd come in the house, and then she'd
Well, sure, the outside time with you is over. Call me. We'll talk.